You're 28 years old and you've had two kinds of fainting. The first kind of faint is the faint that happens when you feel dizzy, lightheaded, you get sweaty, anxious, and it takes about maybe 30 seconds to a minute, and then you might pass out as the vision tunnels and you black out, right? But you also have a second kind of faint, and we saw this faint during the tilt table test, where very suddenly, within 1 or 2 seconds, you just abruptly slump your head to the side on the tilt. And I think in life, without you being on the tilt table, you might fall to the floor very quickly. And you've said to me previously that you might have cut your head or had injury, which was very significant as you fall very hard on the floor. Now, on the tilt, it's very clear that when you have the second kind of faint, the one that occurs very quickly, these faints occurs with a blood pressure and heart rate which is completely normal. So the kind of faint that you have, the second kind, is not due to blood pressure or heart rate. And I want you to just listen to what I'm about to say. Now, there are instances where you can imagine why the faint might occur. And if I give you one example, if you are, say, a Second or First World War soldier on the field, and you have a severe injury on your leg, I don't know if you watch any movies, when they have to cure or amputate your leg, they make you bite on a stick. Yeah. You've watched the movie, and as the soldier gets the treatment, they're in a lot of pain. And this pain floods the brain with a signal to say, pain, 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 I can't stand it. And you bite on the stick, and what normally happens is this person faints, correct? Because of the pain. Now, when this person faints with the pain, there is no seizure in the brain, there is no drop in blood pressure, there is no drop in heart rate. The faint occurs because there's such a surge of pain to the brain can't handle it, and the brain shuts off because it doesn't want to experience this pain anymore. So it's like a software kill switch. The brain just says, stop. And the best way to get rid of pain is to be unconscious, correct? That's one way to think about it. So that's step one. I know you don't have pain, and I know on the tilt you didn't experience pain. So that's not it, right?
And I do have a lot of conditions that cause a lot of pain.
Yeah, so that could be one of the triggers, but I want to bring in a second trigger. Let's say you have a pet dog. Let's say, okay? Do you have a dog?
I have 2 cats.
You have 2 cats, okay. Let's say it's a cat, okay? You have a cat. And what I'm about to describe is a bit gory, but I want you to bear with me, okay? Let's say the cat crosses the street and you see a car coming, and you look at it and you go, the car goes over your cat, okay? It's a very horrific experience, right? Because you know you've just lost something you love, an animal you love very much. This causes a pain as well. It's a very strong emotional pain that comes in. It's not like the pain of having your leg treated on the battlefield, but it's a similar pain. Do you understand?
Sorry.
You get it?
Yeah.
Did it just happen there?
No, it just went.
Yeah, you just lost consciousness there, isn't it?
Yeah, sorry. Because it stresses me out about my cats.
Yeah, it stresses you out. I can see that. Did you get hurt in her eyes? Are you okay?
Yeah.
Good. Your heart rate and your blood pressure are very good. You have a bounding pulse. So your blood pressure and heart rate, I'm sure, are okay. But I'm sorry to have said this to you. Not your cat.
Yeah.
It's father's dog, okay?
Yeah.
Or my dog.
It's still insane.
The story is about me, not about you now, okay? I have a dog, okay? The dog's crossing the road, and I suddenly see it get hurt or get chased by another dog, okay? I get so afraid and emotionally upset that the surge of emotions coming to me, just like the pain, the physical pain, is an emotional pain. What does my brain do? Shuts off. Doesn't like it. And just like what you did, when I was describing your cats, your eyes went up and you lost consciousness for a short while. But your blood pressure and your heart rate were okay. You weren't having an epileptic seizure. And so this is the diagnosis. It's a diagnosis where you're having an emotional surge of pain that shuts your brain down, and so you don't function suddenly. And this can cause falls, this can cause what happened earlier on, where you lost focus and your eyes went up to the ceiling. This is known as a psychogenic pseudosyncope, or if you're shaking, then it's sometimes called non-epileptic seizures, which is seizures without epilepsy. So you're having a moment where you lose awareness or consciousness, but your brain is okay, you don't have epilepsy, your blood pressure is okay, and your heart rate is okay. And the trigger for this is the pain of the emotional trauma. And these subconscious triggers are sometimes we are not aware to it. So we are less aware or unaware of what can trigger this state that causes us to have an emotional state where we have this rising surge that causes our brain to shut off. Do you understand what I've just said? And it means that the way to work on this is actually to unpick one by one, slowly, what has caused the emotional trauma in the past. Or physical, if you have suffered with pain, to try and get a handle of pain. If you have suffered with emotional pain, to try and unpick and unlock some of those things so that they don't subconsciously or consciously bother you a lot.